Good afternoon, everyone. I've had the privilege to stand before you in the past and talk about the stress connection. I'm an obstetrician gynecologist, and after about 16 years of practicing OBGYN, I became interested in other facets of medicine. Actually, before that, bioidentical hormone replacement, and did that for quite a while. But after a few years, I noticed that there was something else that needed to be taken care of, and it was the stress that my patients were under. And the studies show that 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorders. And the more I see patients and the more that I talk to them, I'm convinced that that number is closer to 100%. And if you're going to practice integrative medicine or whatever, however you want to call this, functional medicine, anti-aging medicine, I believe the most important thing that you need to understand is stress. And I've constantly been looking at ways to identify and treat stress. And I've talked about salivary cortisol, we've talked about different things. And today I want to talk about something called heart rate variability. I've spoken from this diagram to try and explain the normal stress response. And to go over this quickly, any type of stressor, what you see in that blue oval, no matter if the stress is physical, if it's environmental, if it's emotional, whatever the stress is, it is going to stimulate the sympathetic nervous system. That is the fight or flight, and that is going to alarm you, and it's going to send a message to the adrenal gland to mobilize glucose with glucocorticoids so that you have the strength to either run or to fight. So that is how that works. And what it's supposed to be, it should be a short-term response. There should be a short-term stressor, a short-term response, and you should not activate this system in a chronic fashion. But in today's society, that's usually what happens. And so I had really been focused on how to use salivary cortisol testing to identify the end result, the chronic production of cortisol, or with adrenal fatigue, the failure of that production. But now I understand better how to identify the early part of this cycle. That red diagram, that red oval, is to identify if there is a change in the sympathetic nervous system. You can identify that stress has a component in your patient's conditions, and you can focus on that. And the great thing about this is that with cortisol testing, it takes quite a while to change that cortisol curve. But when you look at heart rate variability, or if you look at the sympathetic nervous system response, if you add a stress, the sympathetic nervous system is going to be affected. Also, if you remove a stress, the sympathetic nervous system is going to be affected. So as we heard in the previous lecture, the stress of a gluten sensitivity will cause a differentiation in the sympathetic nervous system, so you can identify that with this type of modality. So with an increase in the sympathetic nervous system, you're going to get an increase in the blood pressure, increased heart rate, increased heart contractions. And this is nothing new. This has been around for a long time, and you will find that it is in a lot of the major cardiac journals. The Mayo Clinic Review says that any factor that leads to inappropriate activation of the sympathetic nervous system can be expected to have an adverse effect on these measures and thus on patient outcomes, while any factor that augments vagal tone tends to improve outcomes. Insulin-resistant sympathomimetic medications and negative psychosocial factors all have the potential to affect autonomic function adversely and thus cardiovascular prognosis. So anything that overstimulates the sympathetic nervous system is going to have a bad outcome. Anything that stimulates the vagus nerve or the parasympathetic nervous system is going to have a positive outcome. I like to categorize these as you have fight or flight, which is the sympathetic nervous system, and then you have rest and digest, which is the parasympathetic nervous system. So the parasympathetic nervous system is a repairing type process, where the sympathetic nervous system is more a catabolic process. And as we all understand, we are focused on balance, and these two systems have to be in balance. Yes, you need to be stimulated when that need arises, but you also need to be able to calm yourself down and repair yourself and rebuild your resistance levels, and that is done through normal parasympathetic tone. Here we review the evidence on HRV, linking HRV to established and emerging modifiable and non-modifiable cardiovascular disease risk factors such as hypertension, obesity, family history, and work stress. Substantial evidence exists to support the notion that decreased HRV precedes the development of a number of risk factors and that lowering risk profiles is associated with increased heart rate variability. We close with a suggestion that a model of autonomic imbalance may provide a unifying framework within which to investigate the impact of risk factors, including psychosocial factors and work stress and cardiovascular disease. And then I just want to go down to this conclusion. An altered balance of the parasympathetic and sympathetic nervous activity, mainly explained by an attenuated parasympathetic activity, might contribute to the development of insulin resistance and type 2 diabetes. So I want you to look at this. I treat this as a screening test. Every patient who walks in my office gets a heart rate variability test. It takes about 5 to 10 minutes, but it gives me an idea, is stress an issue? And if stress is an issue, it's my obligation to find out where that stress is, try to attenuate that, because anything that I can do to balance out these two systems is going to improve patient outcome.